Hi, I'm Sarah Krasaniak. I'm the Residency Program Director here at Stanford University. We know that choosing the right residency program can be exciting and also at times overwhelming. We are excited to be able to show you all of the things about our program that make us special. Our four-year program is designed to not only help you master the foundational elements of being an emergency medicine physician, but also take a deep dive into understanding modern patient care. We know that as medicine evolves, so does our role as emergency medicine physicians. Some of the parts that make our program special are individualized learning, our innovative didactic curriculum with hands-on training. We have diverse clinical training sites with a really diverse patient population. And we also have our CREATE program, which is designed to help you develop a niche within emergency medicine. We also pride ourselves on fostering a culture that is innovative and collaborative.
Our year-directed curriculum features a series of didactic sessions tailored to each year of training. For example, the first year focuses on the foundations of emergency medicine and the transition from medical student to physician. Meanwhile, fourth-year topics include job searches, financial planning, practice management, and other subjects that support the transition from residency to a career in emergency medicine. Our simulation center here at Stanford offers state-of-the-art simulations for hands-on learning. We have a specially designed 3-bay emergency room that serves as the setting for high-fidelity simulations. These simulations enable small group case-based learning. We also use specialized task trainers to provide dedicated simulation-based procedural training. Additionally, Stanford's world-class standardized patient program allows residents to work with real people serving as patients. This greatly enhances our residents' skills in ultrasound and their comfort with complex patient encounters. These learning opportunities are further enriched by our monthly journal club, fourth-year grand rounds, and other hands-on experiences that help residents apply their knowledge and skills. Ultimately, we meet learners where they're at and help them become world-class emergency medicine physicians.
Two key tenets of our program are graduate responsibility and individualized learning. Graduate responsibility means that as your skills and confidence grow, so does your level of responsibility. Interns focus on learning. Second years focus on efficiency. Third years have opportunities to teach and supervise. By the fourth year, residents have the confidence and skills to run the entire department. Individualized learning means that we provide detailed qualitative and quantitative data on your clinical performance. These individual assessments offer critical insight into your learning process. They also help establish unique learning goals. Each resident is also paired with a learning coach. Coaches provide a high-level perspective on overall performance. Coaches also work with you to identify actionable steps, such as exploring electives or connecting with a mentor to help you achieve your learning goals. Our approach to individualized learning allows you to build your ideal career in emergency medicine.
Stanford University opened a state-of-the-art hospital with cutting-edge trauma bays, individual patient care rooms, and now completely separate adult and pediatric emergency departments. Our adult emergency department is 43,000 square feet. That's the size of a football field. We use the latest research on patient care to develop a pod system that promotes team collaboration and support. Our trainees also rotate at 2 partner hospitals. This allows for exposure to high acuity patients in diverse settings at some of the busiest hospitals in the nation.
The Stanford CREATE program offers residents a flexible way to develop their individual interests. CREATE stands for Customized Residency Experience and Achievement Through Electives, and it is exactly what it sounds like. A way for residents to personalize their residency journey, which starts during their intern year. Some residents arrive at Stanford with well-defined interests, ready to dive in and take them to the next level. Others are still exploring their options. If you're unsure of your path, don't worry. We have coaches and faculty mentors to help you make the most of your electives. We offer more than 70 electives covering everything from humanities and critical care to innovation and social emergency medicine. These electives are taught by faculty who are nationally recognized leaders in their field. Our electives take residents across California, across the country, and even across the world. And if you have an idea that isn't represented in our catalog, you can create your own elective to truly customize your residency experience. Each year, our residents design 10 to 15 new electives, and we are constantly amazed by their creativity. If you have an idea, we are happy to help you turn it into an incredible experience that will help shape your career in emergency medicine.
We have a diverse patient population here at Stanford. They come from up in San Francisco down to San Jose and all over the Bay Area. About 60% of our patients are Medicare and Medi-Cal. Furthermore, the acuity is incredibly diverse through transplant patients, ACS patients, stroke patients, and all the other complicated medical and surgical care patients that we have here.
We have an amazing community here at Stanford. Our residents are surrounded by world-renowned faculty, an extensive support staff, and 60 co-residents who provide essential peer-to-peer encouragement and inspiration. From your first weeks of orientation, we help you to build those lifelong bonds with your intern class. We also create opportunities early on for you to form connections with the ED care team that you're going to be working closely with throughout your 4 years with us. Interns are matched with a sibling family, which includes faculty and residents from each class year, creating that dedicated support network for questions about California, residency, and life here at Stanford. Each class is also assigned an APD, who provides dedicated guidance, data-driven biannual check-ins, and holistic support. In addition, we offer both a mentorship and coaching program. This helps residents to build their own personal board of directors for career and personal growth from day one. And of course, throughout the year, we make time for social events, whether in faculty homes and favorite local hotspots throughout the campus and the community.
The environment here at Stanford is one of excellence, innovation, discovery, and it's just embedded in our environment. And that's probably my favorite part of Stanford, is this notion that we're here to provide excellent care and also figure out what excellent care means for patients in the future. Our mission here at Stanford Emergency Medicine is to transform healthcare for all through innovation and scientific discovery. Our vision is to define the future of emergency medicine. The way we want to do that is through precision emergency medicine, and that is providing unique and precise care to each person for their unique emergency.
We are excited to show you all we have to offer and being a part of your journey to becoming an exceptional emergency medicine physician.